Antibiotics are not enough for several reasons. Number one, when you have Lyme disease complex, the key word there being complex, you have multiple infections. Viral, bacterial, where the antibiotics work, fungal, you need antifungals, that's not an antibacterial, and antiparasitic. So these patients have both primary co-infections that come from the tick bite usually, like Babesia, Bartonella, Ehrlichia, etc., which we've talked about numerous times before. But then the patients are also suffering with secondary co-infections, which we've published in the Open Journal of Medical Microbiology in 2014, where they actually have viruses that are their co-infection because their immune system is weak, and they'll have fungal infection. So that's why an antibiotic doesn't work, because it won't treat it. That's one reason. The second reason, and there's a number of them here, is that the Borrelia antigen shifts very quickly, making it difficult for the antibiotics to work, which we also published on. So it becomes difficult to treat. And then they make a biofilm community to protect themselves from antibiotics or even the immune system. See, there are multiple reasons why just antibiotics alone don't work. And one of the last ones I'm going to leave you with are actually two more points. One, the infection goes into the blood-brain barrier. Let's say it's Babesia or Bartonella. So you have neuroborreliosis, which is typically the more chronic cases have neurological involvement, memory impairment, Parkinsonian-like symptoms. You can't get a lot of these antibiotics into the blood-brain barrier, so you can't treat them. And then the final reason is they're multi-drug resistance. A lot of these infections we have seen over the years have multi-drug resistance. They're superbugs, so to speak, the term, meaning they're resistant to the typical antibiotics. And that's why you have to use MDR blockers along with your other care to help these patients. So although it was a good attempt for CDC to kind of listen to the public and do something to reach out and help, it's a little too late, because we already knew that information. Any doctor working in Lyme disease and been doing it for a long enough period of time would tell you that when their patients come in, like we see every day, they say, we were on antibiotics, we did IV antibiotics, they didn't work. Well, here's why they don't work. So it's important that we go to the next level, really unveil the new information that's going to help this community that really suffers a lot in care, is by providing the answers to why the treatment didn't work and then tailoring the care to help improve them. So I want to thank you for joining me. I just want to give a little bit of information here to why the CDC study really doesn't tell us anything. And in fact, we should be asking the question, why didn't the antibiotics work in the first place?